If you are over 60 and your legs have been feeling heavy, swollen, or just not quite right lately, I need you to stop what you are doing and pay very close attention to what I am about to share with you. Because what most seniors believe is simple tiredness, normal aging, or just not drinking enough water could actually be your body sending you one of the most important warnings it knows how to send. A warning that millions of older adults ignore every single year until it is too late. Here is the truth that most doctors do not have enough time to explain in a 15-minute appointment. Your legs are one of the earliest and most reliable communication systems your heart has. When your heart begins to struggle, when it starts losing the battle to pump blood efficiently through your body, it does not always announce itself with dramatic chest pain or a sudden collapse. Very often, the very first signs appear quietly, gradually in your legs, in the swelling around your ankles, in the aching heaviness when you climb a single flight of stairs, in the colour of your skin, in the temperature of your feet. And the shocking part is this: a landmark study published in the European Heart Journal followed over 22,000 adults, aged 60 and older, for a period of 7 years. The researchers found that seniors who reported 3 or more of the specific leg symptoms we're going to discuss today were 4 times more likely to be diagnosed with heart failure within the following 24 months. 4 times. Yet the vast majority of those individuals had visited their doctor in the year before diagnosis and never once mentioned their leg symptoms because they assumed those symptoms were simply part of getting older. I am Dr. James Harlow. I have spent my career working with older adults, and I can tell you honestly that the gap between what your body is telling you and what actually gets discussed in a medical appointment is one of the most dangerous gaps in senior healthcare today. In the next few minutes, I'm going to walk you through 7 specific signs that your legs may be displaying right now that are directly connected to heart function. And I am going to give you a simple, at-home check you can do tonight to assess your own risk. Before we go any further, I want to ask you something. Have you noticed that your shoes feel tighter in the evening than they did in the morning? Or that pressing your thumb against your ankle leaves a small dent that takes a moment to disappear? Write yes or no in the comments right now. That single observation is more important than you might realise, and I will explain exactly why in just a moment. Let us begin with the first sign, and this one affects roughly 40% of seniors with early-stage heart failure, yet almost none of them connect it to their heart. Swelling in your ankles, feet or lower legs that worsens as the day progresses. The medical term is peripheral edema, but the experience is far simpler than that. You wake up in the morning and your ankles look almost normal. By the time evening comes, they are puffy, thick, and your socks are leaving deep marks in your skin. You might notice your shoes feel uncomfortably tight by afternoon. This happens because a weakening heart cannot pump blood forward with the same force it once did. Blood begins to pool in the lower extremities. Fluid leaks out of the blood vessels and collects in the surrounding tissue. Gravity pulls it all downward and your ankles pay the price. Now, some ankle swelling can come from standing too long, from eating salty food, or from certain blood pressure medications. But the pattern that should concern you is swelling that is consistent, that gets worse over days and weeks rather than better, and that keeps returning no matter how much you rest or elevate your feet. That pattern is your heart asking for help. The second sign is one that almost every senior I've ever spoken with has explained away as simply being out of shape. Unusual shortness of breath when doing things that never used to wind you. Walking to the mailbox, climbing one flight of stairs, carrying a light bag of groceries from the car to the kitchen. When your heart is struggling to pump efficiently, fluid can begin to back up into the lungs, a condition called pulmonary congestion. Your lungs become less effective at exchanging oxygen, and suddenly even simple movements leave you gasping, in a way that feels disproportionate to the effort. If you have noticed that your stamina has dropped noticeably over the past several months, and especially if that breathlessness comes alongside any of the other signs we are discussing today, please do not dismiss it. Your legs and your lungs are often telling the same story about your heart. The third sign is something very specific, and I want you to think carefully about whether this applies to you. Do you wake up at night feeling breathless, as though you need to sit up or prop yourself on extra pillows to breathe comfortably? Doctors call this orthopnea, and it is one of the more telling indicators of heart failure in older adults. When you lie flat, fluid that has been pooling in your legs during the day redistributes upward toward your chest. In a healthy cardiovascular system, this is managed without difficulty. But in a heart that is already under strain, that extra fluid floods into the lung tissue and triggers a sensation of suffocation that jolts you awake. Many seniors tell me they have been sleeping with 2 or 3 pillows for years and never thought anything of it. If you have quietly added pillows to your bed over the past year to make breathing easier at night, that is not a preference. That is a symptom. The fourth sign lives in the colour and temperature of your skin, particularly below the knee. Take a moment right now, if you are able, and look at your lower legs and feet. Are they a healthy pink tone, or do they look pale, bluish, or almost greyish? Do your feet feel noticeably cold even when the rest of your body feels warm? Poor circulation driven by a weakening heart reduces the delivery of oxygenated blood to the furthest points of your body. Your feet and lower legs are the last stop on that journey. When the pump is losing power, those areas are the first to show it. A study from the American College of Cardiology found that chronic coldness and discoloration in the lower extremities was present in nearly 60% of patients who were later confirmed to have heart failure at the time of formal diagnosis. 60%. And yet almost none of those patients had thought to mention it to their doctor. The fifth sign is something I hear described almost every week. A persistent dull ache or heaviness in the legs that is not quite pain, not quite soreness from exercise, but a kind of leaden fatigue that sits deep in the muscles, particularly in the calves and thighs. When blood flow to the muscles is compromised, those muscles become starved for oxygen and nutrients. They work harder to accomplish less. The waste products of muscle activity, the lactic acid, and other compounds that a healthy circulatory system clears away quickly, begin to accumulate. The result is that persistent and heavy, tired feeling that makes your legs feel like they belong to someone else by mid-afternoon. If you find yourself sitting down not because you want to, but because your legs simply demand it, and if rest brings only partial relief before the heaviness returns, your cardiovascular system may be the reason why. The sixth sign is one of the most overlooked and yet one of the most clinically significant. Sudden weight gain of 2 or more pounds within a single day, or 4 to 5 pounds within a single week, without any obvious change in your eating habits. This kind of rapid weight gain has nothing to do with fat or muscle. It is fluid, and when the heart is struggling, the body begins retaining sodium and water as a compensatory mechanism, a desperate attempt to increase blood volume and keep pressure up. That retained fluid adds weight fast, and a significant portion of it settles in the legs and abdomen. Cardiologists routinely instruct heart failure patients to weigh themselves every single morning for exactly this reason. A sudden jump on the scale, especially when paired with increased swelling or worsening breathlessness, is a red flag that demands immediate medical attention. If you do not currently own a bathroom scale, I would strongly encourage you to get one. This simple daily habit could genuinely save your life. The seventh sign is the one that tends to surprise people the most because it seems so unrelated to the heart. Visible veins in the neck that bulge or appear distended, especially when you are sitting upright. You may have noticed this in yourself in the mirror or had a family member point it out. When the right side of the heart cannot keep up with the volume of blood returning to it, that blood backs up into the large veins of the body, including the jugular veins in the neck. When those veins become visibly prominent without any straining or physical exertion, it is a sign that the pressures within the cardiovascular system are elevated in ways they should not be. This sign is often accompanied by the others we have discussed today: leg swelling, breathlessness, fatigue. Together they form a picture that is impossible to ignore once you know what you are looking at. Now I want to give you something practical, a simple home assessment that takes about 3 minutes, and that you should perform tonight and bring the results to your next doctor visit. Find a pen or your thumb, press it firmly against the inner side of your ankle, just above the ankle bone, for 5 full seconds. Then release and observe. If the skin springs back immediately and shows no indentation, that is a reassuring sign. If a visible dent remains for more than a few seconds before slowly filling back in, that is called pitting edema, and it tells you that fluid is accumulating in that tissue. The deeper and longer lasting the indentation, the more significant the finding. Next, sit in a comfortable chair and rest for 5 full minutes. Then stand up and pay careful attention to whether you feel any dizziness, lightheadedness, or sudden weakness in the legs. Changes in blood pressure upon standing, known as orthostatic hypertension, are significantly more common in seniors with compromised heart function and increase fall risk dramatically. Finally, sit quietly and count your resting pulse for 1 full minute by pressing 2 fingers gently against the inside of your wrist. A resting heart rate that is consistently above 100 beats per minute, or one that is irregular or skipping, is information your doctor needs to have. Write down all 3 results. Bring that paper to your next appointment. These numbers, combined with your symptoms, give your doctor a clearer picture than a 5-minute conversation alone ever could. I know what some of you are thinking right now. Dr. Harlow, I have had these symptoms for a while and my doctor has never seemed concerned. I want to say something important about that. Doctors working within a brief appointment window rely heavily on what you tell them. If you walk in and say, I have been a little tired lately, that opens a very different conversation than if you walk in and say, I have noticed my ankles swell every evening. I am waking up at night needing to sit up to breathe, and I gained 3 pounds this week without changing my diet. The second statement activates a completely different level of clinical attention. You are not being a difficult patient by bringing specific, detailed information to your appointments. You are being exactly the kind of informed, engaged person your doctor needs you to be. The research is absolutely clear on this. Patients who actively participate in their own care, who track their symptoms and communicate them specifically, have measurably better health outcomes than those who wait and hope the doctor notices something is wrong. Heart failure is not a death sentence. I want to be very direct about that. With appropriate management, with the right medications, lifestyle adjustments, and monitoring, many people with heart failure live active, full, and meaningful lives for years, and even decades after diagnosis. The danger lies not in the diagnosis itself, but in the delay. Every month that passes with unmanaged heart failure allows the heart muscle to weaken further. The earlier the condition is identified and treated, the more options remain available and the better the long-term outcome. There are also meaningful lifestyle choices that can support heart and circulatory health right now. Reducing your sodium intake is one of the most powerful tools available because sodium drives fluid retention. The American Heart Association recommends that adults over 60 aim for no more than 1,500 milligrams of sodium per day, a target that is easier to reach than most people expect once they begin reading labels. Gentle, consistent movement, even short walks, improves circulation and supports the heart muscle without overloading it. Elevating your legs in the evening, resting with your feet above the level of your heart for 30 to 45 minutes can help reduce the fluid accumulation that builds throughout the day. And perhaps most importantly, monitor your body. Weigh yourself every morning before eating. Notice your ankles before and after a day on your feet. Pay attention to your sleep and your breathing. The signals your body sends are real and they are meaningful. The habit of paying attention to them is one of the most powerful health decisions you can make at any age. So here is what I want you to take away from today. Your legs are not just the things that carry you from room to room. They are a window into the health of your heart. Swelling that returns every evening. Legs that feel heavy and exhausted. Breathlessness on simple tasks. Waking at night unable to breathe comfortably. Cold or discoloured feet. Sudden unexplained weight gain. And visible veins in the neck. These 7 signs can appear one by one, quietly, gradually, over months. And together they can be telling you something your heart urgently needs you to hear. You have spent your whole life taking care of the people around you. Now it is time to take care of yourself with the same devotion. You deserve to wake up every morning feeling strong. You deserve to walk through your day without that dragging heaviness in your legs. You deserve to breathe easily and sleep through the night. And the path to that begins with paying attention to what your body is already trying to tell you. If this video helped you see your own symptoms in a new light, I want to hear from you. Drop a comment below and tell me which of these 7 signs you have experienced and whether you have ever mentioned it to your doctor. Your story might be exactly what another senior needs to read to finally take action. Share this video with someone you love who is over 60, a parent, a sibling, a neighbour, a friend. They may be living with these signs right now and have no idea what they mean. You sharing this could genuinely change the course of their health. Subscribe to this channel and turn on notifications, because every week we bring you honest, research-based information that puts the power of your own health back in your hands. I am Dr. James Harlow. Take good care of yourself, and I will see you in the next one.